So welcome everyone to the latest installment of CADCA's Research into Action webinar series. My name is Seokjin Justin Hong, and I'm the Senior Analyst on CADCA's Evaluation and Research team. If you haven't previously participated in one of our webinars, the purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. In today's webinar, we are grateful to have Dr. Seth Noor join us for this exciting presentation on findings from his recent article, Impact of Vaping Prevention Advertisements on US Adolescents, published in JAMA Network Open. And just to give you a quick introduction, Dr. Noor. Dr. Seth M. Noor is the James Howard and Hallie McLean Parker Distinguished Professor in the Hussman School of Journalism and Media at the University of North Carolina at Chapel Hill, and a member of UNC's Lineberger Comprehensive Cancer Center. Dr. Noor directs the Communicating for Health Impact Lab at UNC, which conducts health communication research on message effects and communication campaigns. His recent work has been in cancer prevention and control, especially tobacco prevention and control messaging. Dr. Noor is currently the principal investigator on 2 R01 grants from the NIH and FDA that are focused on communication strategies for e-cigarette and vaping prevention. Now I will turn it over to Dr. Noor.
Okay, thank you, Justin. Let me bring the slides up here. Okay, well, thanks for that great introduction, Justin, and great to have so many people on from so many different places. I got to give a shout out to the folks from Rhode Island. That's where I got my, it's where I went to college and spent many years there, and I grew up in Connecticut, actually, so shout out to people in Connecticut as well, and now I'm down here in North Carolina. So I'm going to also talk about the article that Justin mentioned, but also kind of talk more broadly about vaping prevention communication, focusing on current research and evidence-based recommendations. So what my goal today is to do really 3 things. The first is to introduce you to a really exciting resource that we've developed here at UNC called Vaping Prevention Resource. The second is to share some of our current research about vaping prevention messages and share what we did in those studies and what we found. And then third is to kind of take that work and share it in the form of sort of best practices for vaping prevention communication coming out of the research that we've done and drawing on what others have done as well. So I want to start with Vaping Prevention Resource. This is a you'll find it at vapingprevention.org. And there's also some links later in the presentation if you're interested. So this is a resource that we developed to support health practitioners and communities, and it can also be used by researchers. My colleagues Kurt Ribisel and Hannah Prentice Dunlap with myself sort of got this going, and now we have lots of folks working on it, including Steph Trilling, who I think is on the call today. So what is this? So this is an online resource at vapingprevention.org. So one of the things that we do is we collect vaping prevention messages from all around the country, state, local, federal, and it's all open access. So you can go on there and you can search for different things, there's different filters. And so you can take a look at all the variety of vaping prevention messages that folks have used to get inspiration for developing new messages and for other purposes. As you can see, we have 950 items in the media gallery, print messages, videos for more than 30 organizations. So that's one kind of part of the resource. And then the other part is more focused on policy. So there's some things up there on the site around case studies. There's a policy playbook that's out there on how to implement effective policies to reduce vaping in your communities. So I definitely encourage you to check it out, and it's all free and open access. And the last thing about Vaping Prevention Resource, we recently launched a newsletter. So if you're interested in being connected to it, I encourage you to sign up for the newsletter. There's a link at the end of the presentation. We have over 700 folks now who have signed up for it. And it's bi-monthly, so it doesn't come out too often, but often enough, hopefully, to keep you up to date on the latest information on health communication, research, policy, and advocacy related to vaping prevention. Okay, so now I'm going to pivot to some of our current research and tell you about some of the things that we've been doing and what we're finding. And then we get to the end of the talk here, we'll have time for some questions and discussion. So I look forward to that. So we know that communication campaigns are an evidence-based approach to preventing tobacco use. This has been campaigns have been used successfully in smoking prevention, for example. But when vaping started to emerge, we didn't really have research on what kinds of messages would be impactful for vaping. And we're still learning a lot about what kinds of messages are not effective in discouraging vaping. So we've been doing a lot of work in this area over the last few years. And I'm going to share with you a couple studies that we've done and what we found, and how that sort of informs kind of best practices and evidence-based practices for vaping prevention. So the first study we did occurred in 2 phases. And so actually in this study, we used 220 messages that actually came from Vaping Prevention Resource that we had collected state and local practitioners from all around the country and federal. So these are actual messages that folks are using out there. And these are sort of web print messages. So we didn't do videos for this study. We used sort of static messages. And what we did, and we had a 2-phase study. So in one phase, we do a content analysis where we code the different features of the messages with 2 coders. And I'll show you an example in a moment. So we're doing objective coding of what features do the messages actually have in them. In the second phase, we do an experimental study where we have adolescents rate the messages on something called perceived message effectiveness. And then we're able to look at to what extent do certain features associate with higher and lower ratings. So let's talk about the coding for a minute. So here's 2 different vaping prevention messages. These are real messages, one from the FDA, the other one I believe is from the American Heart Association. These are 2 messages we actually used in the study. And you can see, for example, on the left, this message was coded as a nicotine addiction theme because it's about a nicotine addiction. It has vaping device images on it. It has a pod on it. It talks about health symptoms of vaping, right? Cravings and other symptoms. And it uses the second person. Vapes can expose you to nicotine. On the other hand, we have another message here that uses more of an industry targeting theme, focusing on big vape. It uses a hashtag. It has a bright vivid color, and it uses the first person. It says, but we won't get sucked in. So these are some of the features that we coded these messages on, and then we're able to look at which of these features looks more promising and less promising for vaping prevention. And as we'll see, there's some features that we really want to avoid in our messages, which was really interesting. So that's the coding. Then in the second part of the study, what we do is we randomize, so an adolescent's not going to rate 220 messages, right? It's too many. So we have this design that we use where each participant rates 7 messages randomly selected from the pool of 220. The messages are presented in random order to control for order effects. And so we end up getting a sufficient number of ratings for each of the 220 messages. Now, what are they rating these messages on? They're rating these messages on something called perceived message effectiveness. There's a big literature on this, and we've done a lot of work in this area. And the scale that we used essentially predicts effectiveness. So messages that score higher on perceived message effectiveness are more likely to actually have impact. Those that score lower are less likely to have impact. So it is tied to actual impact of messages. And it's a good tool for getting some receptivity data in terms of how adolescents are responding to the messages. So this is the perceived message effectiveness scale. So actually a scale that we developed and that we used in this study. So when adolescents see a message, this is what they answer. They answer these 3 items. How much does this ad make you worry about what vaping will do to you? Make you think vaping is a bad idea? Discourage you from vaping? And this scale was developed through extensive formative research with cognitive testing and lots of things. So we know youth understand it, and it's tapping what we want them to tap. And they answered on a 1 to 5 scale, from not at all to a great deal. And the items get summed together into a scale. So for this study, we did an online national sample of 1,532 adolescents. When I say adolescents, in these studies, we've been focusing on ages 13 to 17. And you can see some of the breakdown in terms of race and gender. We did some oversampling to try to have as racially diverse a sample as possible. Still 70% white, but we had over 20% Black or African American and Hispanic Latino, about half and half in terms of male female. And then we also oversampled in terms of vaping risk. So we ended up with 30% were past 30-day users. So teens who had vaped in the past 30 days, sometimes called current users, 44% were susceptible to use. For folks who aren't familiar with that, there's a well-validated scale that folks fill out, and essentially it's like there's several items. There's four. It's a 5-point scale, and teens essentially have to say definitely not, definitely not, definitely not to all the items to be not susceptible. So kids who are open at all to vaping are considered susceptible. So we had 30% past 30-day users, 44% susceptible, and then we had 26% non-susceptibles. We did include those as well, but we oversampled the higher risk kids to have good samples of those. So, okay, so I try to boil this down in a fairly easy format to present, to not get too caught up in lots of wonky statistics. But what we do here is we compute multi-level models where we control for demographic characteristics, and we look at the extent to which the message features are associated with perceived message effectiveness. And there's basically 3 outcomes that are possible. One is that there's a positive effect. That means that that feature is likely to be a good thing to include in your messages. There's a possibility of a negative effect. That means that that feature is probably not a good thing to include in your messages. There's also a possibility of no effect. And for no effect, it doesn't really matter if the feature's in there or not. For sake of time, I've left those off since those don't really matter so much one way or the other. So I'm going to share with you what we found for positive and what we found for negative. And it really tells, I think, a nice story of what messages seem really promising for vaping prevention. So I'm going to present these first positive. I'm going to present these in some different buckets. So the first bucket here is content or theme, right? What the message is sort of talking about. What's it talking about? What's the content of it? What's the theme? And so all of this list here, all of these, this content or theme, all of these things were positively associated with perceived message effectiveness. That means that these kinds of topics are pretty promising for vaping prevention. So things like talking about that what's coming out of the vape and into their lungs is actually not vapor, it's not water vapor or vapor, it's aerosol, right? And there's chemicals in the aerosol. Messages focus on nicotine addiction, comparing vaping to cigarette smoking, the health symptoms of vaping, things like health effects on brain or lungs. So this whole list here, all of these things were positively associated, which suggests that these are good things to talk about in terms of vaping prevention. We also looked at some things related to style. So messages that posed a question. And again, these analyses are all relative to the messages not including it. So in other words, messages that posed a question were slightly better than messages that didn't. There was a source included, a source with the message, and then the use of second person language, you, which I showed you an example of that. Those messages scored higher than messages that did not use you. And in terms of imagery, this was really interesting. So messages that used essentially sort of harms type of imagery, graphic images, warning symbols, nicotine symbols, were all perceived as more effective than those that did not. And also messages that showed a combustible cigarette in the message somewhere were perceived as more effective than those that did not. So if you look at this group, you kind of get a picture of what seems to be fairly promising for the kinds of things that we should be focusing on with our messaging. Okay, so what about the flip side? What about messages, message features rather, that are negatively associated with perceived effectiveness? That means that these features seem to be things that we should avoid or use with caution. So very interestingly, industry targeting, sort of the idea of big vape, targeting young people did not fare well in this study. And neither did environmental impact, which that one kind of surprised us because we know that young people care about the environment in many ways, but vape messages that focus on environmental consequences were not perceived as very effective. And the big one I would definitely caution about is flavors. So messages that talk about flavors did not do well. And we even found, which for sake of time, I'm not going to present here, but we even found some evidence that they may increase appeal of vaping because kids see the flavors and it's kind of hard to get past that. So flavors do not seem to be a promising thing to focus on vaping prevention messages. In terms of style, These features, again, were all associated with lower scores on perceived effectiveness. So these are all things that don't seem to be good to include in messages. Bright colors, using hashtags, meme format. Some of the messages were meme format, using the word teen, using I or we language, which would have the message be sort of as if the message was coming from the perspective of the teen, and using statistics were all perceived as less effective. And then imagery, images, messages that had faces in them, whether they were teen or adult faces, were seen as less effective. And images of food, some of them had food in the messages. Again, the messages we tested were all real world messages that folks out there are using. So that part is kind of has a lot of ecological validity in terms of things that people are doing. Though here's another place where you can kind of take a look at the findings and see sort of a pattern of some things that are happening, which I'll talk a little bit more about with best practices, but you get kind of a feel here for what kinds of things are not resonating with teens and are not promising for messages. Okay, so let me talk now a little bit about our second study, and then I'm going to talk about sort of best practices, which won't surprise you because they come very much out of these studies. So this is the other study that I think Justin referenced, and I think may have been linked in the registration that we recently published. And in this study, we were focusing on video advertisements. The prior study was focused on sort of static or print messages. This one was focused on video ads and what kind of impact may video ads have in terms of vaping prevention. The other difference with this study is that we used ads from the FDA's Real Cost campaign, so their national vaping prevention campaign. And in this study, we were able to look at actual impact. Do the ads change beliefs about vaping? Do they change susceptibility? Whereas in the prior study, we were focused on perceived effectiveness. So with this study, we tried to answer two questions. So one question was whether the Real Cost vaping prevention video ads reduce susceptibility to vaping. So do they essentially work and reduce susceptibility to vaping? The second question is one that we hadn't really seen addressed in a really rigorous study, which is that do health harms ads or nicotine addiction ads have a greater impact? And so if you look at the Real Cost campaign, whether it's the prior work that was focused on smoking prevention or vaping prevention, the way that we've kind of seen it is there's two large themes in these campaigns. One is about nicotine addiction and its consequences, and one is about health harms. And it's kind of interesting because these ads that we use really don't have any overlap. The addiction ads are very much about addiction and consequences of addiction, whereas the health harm ads are very much about the chemicals that you're inhaling through the aerosol, possible impact on your lungs or blood vessels. And so they're really quite different in terms of the theme or content that they're focused on. And so we were interested in, again, do the ads have impact in general? And number two, is one theme or the other better? So this was a randomized controlled trial, and we enrolled participants aged 13 to 17. It was a pretty high-risk sample. We screened them. They had to be at least susceptible to vaping, if not currently vaping. So we got a pretty high-risk sample of a lot of kids who were vaping. And again, everyone was susceptible to vaping. So all the kids were at some risk of vaping in this study. And this was a 3-week randomized controlled trial where each week they were exposed to multiple ads, again, with the goal of seeing if we have this exposure, do the ads have impact? And our primary outcome was susceptibility to vaping, a 3-item scale. And those items are answered on a 5-point scale. And they're things like, if a best friend were to offer you a vape, would you use it? Do you think you might vape in the next year? Things like that. And it's answered from definitely not to definitely no to definitely yes, basically. And so our goal here is to see, do these ads reduce susceptibility to vaping? All the kids who came in the study were susceptible at some level. So this is what the study design looked like. So what we do is we screen and enroll folks. We enroll the folks who are susceptible or users. We assess them on tobacco use. They view their ads, and in each condition, as we'll see, folks viewed 3 ads. Then we assess different outcomes like beliefs about vaping and susceptibility. And then they came back for 3 more visits 1 week apart. Visit 2 was 1 week later, visit 3 was 1 week later, visit 4 was 1 week later. It was a 3-week study in total. And what we did is at each visit, first we would assess the outcomes, which I'll show you a little bit about shortly, and then they would view the ads again. So essentially at the first visit, they saw the ads and then we were able to look at if they have an immediate impact. But then at each week, we were able to look at the lagged impact. Do the ads still work a week later? Do they work a week after that, et cetera, while boosting with booster ads each time. And again, at the final time point, visit 4, which is our primary time point, the primary outcome was susceptibility vaping. Primary outcome was that last visit at week 3. All we're doing is assessing the outcomes, and they don't see any more ads at that point. In terms of random assignment, so what we did was we randomly assigned 1,514 adolescents aged 13 to 17. So they either got 3 ads from the real cost focusing on health harms, 3 ads focused on nicotine addiction, or 3 ads that we developed. We developed these very neutral control ads. So they were black and white text. We had a female narrator, and the text was adapted from Wikipedia and other sources. And these ads were about e-cigarettes, but we wrote them in a way that was very neutral. We didn't talk about the good things about e-cigarettes, which are maybe there's harm reduction or things like that. We didn't talk about the bad things about health harms. They were just very bland, sort of neutral informational. And that gives us a comparison comparison condition to control for and compare to. So this is our design. And again, the health harms ads were focused on impact of e-cigarettes on lungs, blood vessels, and especially the chemicals in the vapor. Nothing about addiction. The addiction ads were focused on nicotine addiction and consequences. And then we had our control. So in terms of our results, so this is our primary outcome, susceptibility to vaping. We had an impact and the ads worked. So if you look at the final time point, which is week 4, you see that folks that were in real cost groups, we combined them together for the main analysis, had lower susceptibility to vaping than youth who saw the control ads. And this is true for pretty much for each week here. You can see at week 1, it has sort of the biggest impact right after they see the ads, but even a week later and a week later with it being lagged a week, the message continues to have an impact. And at the final time point, we see lower susceptibility to vaping among adolescents who saw the real cost ads in either group compared to control. So in addition, we also saw an advantage of the real cost ads on a whole series of other outcomes. So in addition to having lower susceptibility at that final time point, youth who saw the real cost ads also had more negative attitudes about vaping. They had higher health harm risk beliefs about vaping. They had higher addiction risk beliefs about vaping. And we even saw an effect on vaping behavior, where we saw a small reduction in vaping behavior among the youth who were in real cost arms as compared to control. Another really interesting thing is I know there's some concern out there that, well, if we give kids harm messages about vaping and tell them that vaping is bad, are they going to smoke instead? Are they going to use more, higher risk combustible products? And so we wanted to look at that sort of like unintended consequences. Are there unintended consequences? And the great news is that there were unintended consequences, but they were good unintended consequences. So contrary to what some people have said or thought, that vaping prevention messages about the harms are going to push kids to smoke, we found the opposite. We found that not only did kids have lower susceptibility to vaping, they also had lower susceptibility to smoking cigarettes at the final time point. They also had more negative attitudes about smoking cigarettes at the final time point. And we have found findings like this in other studies. And so there seems to be something going on here where kids are going, oh, well, vaping is bad. It just kind of reminds them that, oh, smoking is bad too, right? And we're not seeing what some people thought, this idea that kids are going to smoke instead. So that was exciting. We didn't necessarily expect that. So, okay, what about the second research question about does one theme work better than the other? The answer is they're about the same. So at the final time point, there was no difference between the two real cost trial arms on the primary outcome, susceptibility vaping at visit 4. There was a couple little points to which we saw a tiny advantage for health harms ads over nicotine addiction, but very, very small. And so I think overall, we conclude that both themes can work well. Youth don't always really understand nicotine addiction, right? But a lot of these ads do a really good job at illustrating not only addiction, but the consequences of addiction in a context that young people can understand. And so those do well as the health harms ad. So in this rigorous test of these two themes, both did well, showing that both of these themes are promising for vaping prevention. Okay, so part 3 here in terms of evidence-based recommendations for vaping prevention messages. So we've kind of grouped these into best practices and practices to avoid or use with caution. And again, these won't come as a shock to you seeing the results of our studies here, because they come right out of the results of the studies that we've done, and also us looking at the broader literature of what others have found, much of which is very consistent with what we found here. So in terms of content, so these kinds of focuses on some of the harms of vaping and addiction consequences seem to be promising. So nicotine addiction, but also its consequences, specific chemicals that are found in e-cigarette aerosol, especially ones with negative connotations like formaldehyde and things like that, vaping symptoms and health effects. As we know, when vapes first came out, some people were thinking that they were, virtually harmless, and we know now that that's not the case. So comparing vaping to smoking, I think we want to be a little bit careful with this one, because we don't want to equate the two as the same, right? We know that just the incredible health harms of smoking, and with vaping, we're starting to learn more and more about the harms, but we don't have nearly the evidence base as we do for smoking. So we have to be a little bit careful with this one, but it does seem to be effective in messaging in terms of reminding kids that this is sort of a new form of smoking. In terms of style, second person language fared really well. And so that is recommended, and using credible information and sources to back up, where the information is coming from and who the source is, which can be important. And then in terms of imagery, again, graphic images, warning symbols, possible cigarette imagery, all fared really well. And so this kind of imagery, I think, can essentially reinforce the theme and the content of what we're trying to tell kids about vaping, which is that it's not harmless, right? I think most people out there think it's not as harmful as smoking, but the more we learn about vaping, the more we're seeing that there's more harms than people thought. And so some of this imagery can help with communicating to young people about some of the harms and the addiction consequences. So, I want to show you this. So these are 3 messages. Again, we tested a pool of 220. And so these are 3 messages that were in that pool of messages that fared really well. So these were 3 messages that were rated really highly on perceived message effectiveness, and are examples of sort of promising messages. You can see that they contain some of the features that we talked about, which is why they scored highly, right? So they talk about, this one's about Juul. Juul's getting a little outdated, but this one's about Juul, containing 20 times more nicotine than a single regular cigarette, right? We know a lot of vapes have very high nicotine content. And you see the kind of a cloud of dark smoke. The center one, nicotine can cause seizures. You're talking about a health symptom of using too much nicotine. You see sort of a graphic image of the brain there. And then the message on the right is one from the real cost, talking about dangerous chemicals and impact on your lungs. And then the images of the kids are kind of graphic in a sense, right? So these are some of the messages essentially that scored really well in our study and contain some of the features that seem promising. So, okay, let's talk about the other side of the coin, which is practices to avoid or use with caution. And then I will also show you some examples of those, of messages that exemplify those. So as I mentioned, flavor content is something we have to be really careful with. It seems to be as soon as we say flavors, we sort of lose kids because flavors, as we know, are what make vapes so appealing. I would recommend avoiding talking about the flavors if you're trying to do vaping prevention as much as possible. The industry targeting, that was very successful for the Truth campaign with cigarettes, but we're not yet really seeing that here. It may be because with cigarettes, we saw such immense harm, and the harm message was tied in with the industry targeting message. And we have not sort of yet seen the same kind of harm with vaping, but we did not find that to resonate. And a little bit surprisingly, the environmental impact. I do think the young generation really cares about the environment, but pairing it with vaping does not seem to be as impactful as we might have hoped. So I don't think there's a lot of harm in some of these, but from the work that we've done, we're not seeing much of an impact with those kinds of messages. In terms of style, so the story that we take away from the style is that a lot of these messages we're trying to take the teen's perspective, and we're trying to be teen-like, using memes, using hashtags, having the message come from the perspective of the teen. But the problem is these messages were not coming from the perspective of the teen. These were not testimonials. These were messages, from local health departments or other kinds of organizations. And so I think, our guess is that teens sort of saw through that and saw these organizations as trying to take their voice and didn't see it as authentic. And so in that sense, those are not recommended in terms of going down that path. And also, sort of general statistics also did not fare well in our work here. And then in terms of imagery, food or animals, again, the picture clearly emerged that imagery that is sort of negative, that fits with this message about nicotine addiction or harms or things like that, or combustible cigarettes did well. And there were if you're talking about flavors and you have images of strawberries, those do not do well from a vaping prevention perspective. So avoiding positive imagery, even if the message is negative, sometimes what people are processing, we know this from communication work, people will process the positive imagery and not read the text carefully. And then they're taking away with a brief look at the message, a more positive view of vaping as opposed to the negative view that we're trying to promote. Okay, so for the other side here, so here are a few messages that did not do well in the study. They're rated pretty low on our perceived message effectiveness scale, some of the lowest. And again, these exemplify some of the exact features that I just talked about. You have kind of a big vape type of message. It uses a hashtag. It's got that bright red color. Those features did not resonate much at all. And so this was rated really low. The one in the center, this is what I mean by kind of the positive imagery and the flavors, trying to take that and turn it around in a vaping prevention message just does not work well. I know that the FDA tried some messages around flavors, video messages, and they all failed, and they did not produce or put any of them out there because I think they found some similar things in terms of it just not resonating, and kids see the cotton candy and maybe take the wrong message from it, or at least it's not impactful. And then here's an example of an environmental one. Vapes are trash, right? And this just doesn't seem to have the kind of impact that we want to have. And so again, these were all rated really low, and this and it's likely because of these features that we've talked about that don't seem to resonate or have an impact. Okay, I'm going to move towards wrapping up here and do so by circling back to vaping prevention resource. So what I just talked about with all the best practices and everything, we created a fact sheet. We developed a fact sheet based on that, which is published and available on Vaping Prevention Resource. So you'll see that here, where we talk about these content, style, and imagery features that we think are promising and best practices. And we show some examples of messages that have used those. And we also have part of the fact sheet on the other side of the coin, things to avoid or things to be careful with, and some examples of those. So feel free to check that out at vapingprevention.org. And as I mentioned, I believe the slides will be available after the webinar ends. There's a link to the newsletter sign up if anyone wants to sign up. The link is on there. And you can also, if you have ads you want to submit to our media gallery, it's an open access media gallery. So we really want to collect messages that are okay to just put up there open access, so we don't have paywalls or anything like that. So feel free to submit those to us as well. And that's a wrap. Thank you. Really appreciate the time and excited that so many people were interested to be here today. Research is a team sport, so I always have to do a huge thank you to all my collaborators, our project managers, PhD students, master's students, faculty colleagues who worked on this research with me, and acknowledge our funding sources from NIH and FDA, and I have my disclosure up there as well. So I'm gonna pause there and share my screen and turn it over to Justin here to moderate the Q&A.
Alrighty, thank you so much for your presentation, Dr. Noor. So I will go ahead and kick off the Q&A here. Here we go. So CADCA will first ask Dr. Noor a few questions to kick off the Q&A, and then we'll turn it over to the participants to ask your own questions. If you have a question for the presenter, Dr. Noor, please go ahead and type it in the Q&A box if you haven't already, while I start the Q&A session with a few of my own. So first, when considering the evidence-based recommendations for vaping prevention advertisements, how can coalitions and substance misuse preventionists best utilize personal anecdotes?
That's a great question. In the and this is where there's some nuance. So in the study, the print study that I presented, we had it's hard to do personal anecdotes in a static print message, right? So there really were few, if any, in that study. So that study doesn't really tell us that much about personal anecdotes and stories, but we know from lots of research, increasing amounts of research in the health communication field, that stories, anecdotes, testimonials can be really powerful in lots of areas, including, I think, in vaping prevention. So I think that's something that folks can use. Again, probably not in a print message, but in a in person, interpersonal, in a video message. The FDA has done some with that. Folks may know their Real Cost campaign, they created some personal testimonials, especially around addiction, to try to have kids tell the stories about getting addicted to vapes and how it impacted their lives. And I think that was a good example of how you can use those. We have to make sure that teens see those, we have to make sure that those are authentic and that teens see those as authentic, especially coming out of what we found, that teens sort of saw through the print messages that were trying to sort of take their voice. So those are a couple thoughts that I think that can be powerful, especially if they're real, credible, believable stories. We just have to make sure that that we do that well, and that kids see that these are real stories and not something that we're sort of making up, or not something where we're trying to take their voice from them.
Perfect. Thank you so much. I think that's something, I guess, it's important to keep in mind when you're going over like the I versus you language, that the type of research focused on the static messaging, not personal anecdotes as much. So maybe that's something else that people can definitely explore and still utilize for community coalitions.
Definitely, that's a great point, Justin. Every study that anyone does, it tells you something about what's going on out there, but it doesn't tell you everything. So that is an important point. The I language, we language did not work well in print messages, but that does not mean that it can't work well in video. In fact, let me just add one additional thing. In the second study I showed you, where we tested the Real Cost video ads, I think at least one of the addiction ads was a personal testimonial, and that worked. So there's a little bit of it may be able to work well in a video format, but in a print format, it's probably not the right format for a personal testimonial.
Sure. Perfect. Thank you. And so the next question, I don't want to read the entire thing, but scare tactics, quote unquote, are very hot topics here, and they've been addressed in previous research into action webinars as legitimate forms of prevention advertising versus others who kind of argue against them. I just wanted to ask about what your research has shown about them.
Yeah, great question. Yeah, so this is, of course, this is a debate that may go on forever about, so there's lots of different ways that one could answer this. I think stepping back for a minute, though, one thing that I would say from being a health communication researcher for a good amount of time now is that messages that have impact tend to be messages that evoke emotion, right? And so if we put fear aside for a minute, but we just step back and think more broadly about emotional reactions, there's lots and lots of research showing that, messages that evoke emotion, particular types of emotion, are more promising for having impact. So, in fact, when I look at that environmental message that I showed you about vapes, and you see the vape on the ground, it just doesn't evoke any emotion, right? It's a vape sitting in the soil, right? Whereas when you see that the brain, and what vaping could do to your brain, for example, that evokes more emotion. So more broadly speaking, emotion is an important thing that we have to consider. There's been more and more attention to it. In terms of fear appeals, it's a big subject. There are messages that people have developed and called fear appeals, and it turns out they don't elicit fear, right? People don't think they're funny. They don't believe them. So if they're done well, they can work. I think at the end of the day, our messages should tell young people about the real consequences of vaping, both addiction and health harms. We shouldn't exaggerate, right? We shouldn't go way past the scientific evidence to exaggerate. That's going to hurt our credibility and not be believable. So we shouldn't go, over the top. But negative emotion is something that can work. And by the way, in the trial that I showed, the second study of the real cost ads, those ads do elicit negative emotions. I didn't show that here. It's in the paper. Things like fear, they elicit more of that than, for example, the control ad. And that seems to be part of how those kinds of messages work. And so if you look at tobacco control more broadly, there's a lot of use of warnings, graphic warnings, the Tips from Former Smoking campaign. There is a lot of use of that kind of harms messaging with fear, and folks use it because it works, right? So I guess that's what I would say, is that we shouldn't be afraid to use emotion. We need to use it well. We don't want to exaggerate, but it's not something that we should just totally walk away from.
Sure. And I think that's really important to kind of like highlight that nuance. I know in the last Research into Action webinar, one of the presenters had actually shown us that subjectively, people who were being kind of asked about the fear appeal had noted that they did not believe it was effective, but then when measuring the outcomes, it had actually kind of shown the opposite direction. So I think it's something that I've always kind of been curious about. And
Yeah. One additional thing, one thing that we know too is that this applies more to smoking cessation, in the sense that, well, what I mean is that we don't want to scare people, but then not give them a solution, right? So for instance, for smoking cessation, if we use fear-based messaging, like for instance, the Tips from Former Smokers, we need to really boost their self-efficacy, give them resources, quit lines, other resources to be able to quit. That's really important, that we're not just scaring people, but not giving them a solution that's accessible to them. I think there's a little bit less true in vaping prevention, in terms of, except for kids who may be highly addicted, but that's also an important point too.
Sure. And finally, from me, just because we have a lot of questions in the Q&A box here, what other resources do you recommend local communities utilize? I know you talked about a bunch in your presentation, so if you want to just kind of speak more to those, or if there's any other that you want to mention. Yep.
Yeah. Obviously, the main resource I plugged is something that we developed because we just saw a lot of opportunity here and a lot of important work that needed to be done, and we wanted to pull a lot of the messages together into one place in our vaping prevention resource. And then my colleague Kurt Ribisel does a lot of policy work, and so we're focusing on that side of it as well. So definitely check that out. That's kind of my main recommendation in terms of something that's new. A lot of the practitioners out there may be familiar with other resources and things like that are out there. The CDC, for people who are looking for messages, the CDC also has a database of messages as well. But those are just a couple things there that come to mind.
All righty, thank you so much. So we do have a lot of questions. So Dr. Nora, if you want to also take a look at the Q&A box and see if there's any you'd like to address. One of the first questions we did have, though, were, are there clean air policies and guidance on the vapingprevention.org site?
That is a great question. I do not know the answer to that question. I'm guessing probably not, but I'm not sure about that. Again, we don't. Maybe something we need to add. There's we don't have everything up there, but I don't believe we do.
Perfectly fine. And if there's anything anyone wants to follow up with, feel free to message me and I'll can get that over to Dr. Noor, or if Dr. Noor, you want to answer any of the questions and provide them with somewhere they can contact you, that would also be great. One of the questions that kind of does relate to this, did any of the ads included in the static message study use a social norms approach, or were they all educative?
Great question. There were, that's a really good question. There were almost no messages, and this is one limit. Again, our studies have limitations. So we talk about one limitation, that print messages aren't really good for testimonials, right? So we can't really say much about, excuse me, personal stories and testimonials from that study. Another limitation is that this, we used real world messages and we collected and screened as many messages at the time. We did this study about 3 or so years ago. We screened and collected as many messages as we can, real world messages. And so the body of messages was what people were using, right? And so there were almost no messages, just a few messages that touched on any aspect of social influence or anything like that. And we really wanted to look at that to see if messaging in that realm had promise or not, but there just weren't enough. There was just a few little scattered things. So the short answer is no, there were not social norms messages. Folks have used those in alcohol binge drinking and things like that to try to change social norms and had some success with that. But they were not in our pool. And I haven't really seen much at all, actually, in terms of social norms messaging and vaping prevention. So that's kind of an open question, I think, as to whether those might work or not.
Got you. And actually related to that, would this research apply to other substances like alcohol?
Oh, that's a really good question. Would this research apply? That's a great question. In terms of the alcohol is becoming more and more of a hot topic. It seems it's quite different, obviously, than vaping. So I definitely would not say, oh, we can apply all these things by any means. So I don't know. I think some of the format and style things that we found may have more applicability, but in terms of, like, if you want to talk about the harms of alcohol or some other things to try to reduce alcohol use among youth or prevent it, I don't think we can say that these kinds of things would apply, since it's so different. Vaping, as we know, is such a unique kind of behavior in all kinds of ways, coming out originally and people thinking that it was essentially harmless or minimally harmful, and there's still so much rhetoric and stuff out there about harm reduction is kind of unique in that way. So I don't think we can really say, oh, this applies to alcohol. Like I said, it may be that some of the format style things may apply, like, oh, let's be careful not to take teen's voice unless this is something that's authentic. But there could be some things like the industry manipulation. We just didn't find that to resonate. And that may also be true with alcohol, because kids tell us, well, there's lots of bad industries out there. There's lots of big companies they don't like, but they still buy their products. So that there may be certain things like that do apply, but we definitely want to use caution, not thinking that everything else would apply.
Sure. And thank you so much for your patience, everyone. There are a ton of questions in the question box, so I don't think we'll be able to get through all of them.
I see that, yeah.
They just keep filing in there. But here's one question that is asked about the study here. So can you talk more about the types of graphic images that seemed successful? I know you said images representing flavors were not great, but which ones were rated as being more effective?
Could you repeat that, Justin? Sorry, I missed the first part of that.
Sure, that's the one. So can you talk more about the types of graphic images that seemed successful? I know you said images representing flavors were not great, but which ones were rated as being more effective?
Yeah, good question. So there was kind of a variety of things. I showed you that one that was kind of the brain. Um, there's one that the FDA has where they're talking about some of the chemicals that are in vapes, and they have this image of, I don't even know exactly what it is, but it's just this sort of ugly image of one of the chemicals. There's one thing we do have to be careful though, is not to exaggerate. So interestingly, what I think maybe the highest rated message in the whole study was one that talked about like, vaping damaging your lungs. And it shows these lungs that are like extremely damaged, but we kind of have questions about, is that we don't think those are real lungs damaged from vaping, right? And so so we have to be careful that what we're showing is accurate and and not exaggerated. But so those are some of the kinds of things. I don't think from this study, I don't think it tells us these are the exact kinds of graphic images that we should use. But what it does tell us is that, and we also know from other work, like work in graphic and pictorial warnings, cigarette warnings, that kind of imagery can be really powerful, right? People process images much more quickly and easily than we process text, right? And images can provide a nice complement in helping us understand what the text is saying. So I think if you have messages that you're trying to get across, you can think about, what kinds of images would help get that message across. And again, with the flavors and things like that, the big picture guidance is avoid images that have really positive connotations, right? Because you're trying to, particularly in harms messaging, because you're trying to communicate the harms, right? And not either purposely or in this case, not purposefully communicate something different than that.
Sure. And I think this kind of touches on this as well, but someone did also ask, what about using humor? How effective is humor to send a serious message to youth? Did you happen to have any data in the research specifically related to humor?
That's a great question. Yeah, humor is one of these things that is kind of gets batted around a little bit in terms of, it's not used that often. I know the Truth Campaign used it in some vaping prevention messages. I don't know if folks saw those a couple of years ago. They were the tested on humans video messages that they had, where this whole idea that, like, since we don't really know a lot of the health effects of vaping, and probably won't know for another decade or two, that the vape industry is essentially doing a big test on humans, sort of akin to animal testing. They did it in a humorous way. I'm not sure. I know they published a paper showing that their ads were having some impact. I'm not sure if it included those ads. I think humor is one of those things that could potentially be used, even in an area like this. It's just really challenging to get it right and to make sure that the humor is advancing the message that you want to advance, rather than just kids finding it funny or laughing at the message, right? So I think that's the challenge with humor, which may be one reason why it's not used that much in health campaigns in general, because it's challenging to get it just right, both for the audience to find it funny, but for it to advance the message rather than kids just laughing at the message. So that's one thought there.
Definitely. And there was also another question about some of the few main differences between prevention and cessation communications that people should keep in mind in public health.
Prevention versus cessation.
Mm-hmm.
Yeah, I've done a lot more work on the prevention side, and
Right.
so a lot of what we're presenting here are things that are really promising for prevention. Now, with young people, of course, there's some gray area, right? So so a lot of our work is focused on kids who are susceptible to vaping, and many of these kids have never vaped at all. The way that we have measured it, some of the kids have tried vaping. Maybe they tried it once or twice, but they're not vaping recently. We've defined those folks in many cases as susceptible. And then we include current users in our studies, as we know from a lot of the data, including the National Youth Tobacco Survey. current vapors are kids who have vaped in the past 30 days, right? And some of those kids may have just vaped once or twice or 3 times. And so it's unlikely that those kids are addicted. And so we include them in our prevention research. Obviously, at some point, if kids are vaping, say, every day, then we assume, that they likely are addicted. We've taken the same approach that the FDA has in including all those folks in our prevention research. With a broader view of prevention, because again, a kid who was just vaped once or twice in the past month doesn't need a cessation sort of intervention. But clearly, once you get to kids who are clearly addicted, and we know how addictive vapes are, especially many of the products coming out today, then kids at that point, it's not just the message, right? It's they may need other help, support, and things like that to be able to quit, because it's very difficult, right? So I can't say that much about what vaping, what cessation messaging should look like for vaping, because I haven't done work in that area with people who are addicted or highly addicted. I can say a lot more about the prevention side. It may be that some of the prevention type messages about harms anyway could motivate people to quit, but then again, they're likely to need probably more than just messaging in terms of quitting.
Well, thank you so much for going through and answering all these questions with us. I want to be respectful of your time, Dr. Noor, and also all the attendees here. So I am just going to wrap up here. If anyone has any other questions you want to ask Dr. Noor, you can feel free to email me at jhong@cadca.org, and I will make sure to compile some of the questions and send it over to Dr. Noor. I also see a lot of questions about resources, so in my follow-up email to everyone, I'll make sure to compile everything and send that, in addition to the recording and the slides as well.
Sounds great. Yeah. Well, thank you, everyone. Feel free. Yeah, Justin, if folks have requests or whatever, feel free to reach out to me, and I can try to direct them to resources or share whatever can be helpful. So just let me know.
Sure. Thank you so much. And as I mentioned, I will distribute the slides to those who participated following the webinar. The email will contain short evaluation as well for the webinar. Please fill it out. You do need to fill out the evaluation to receive the letter of participation for anyone asking about CEUs. And then you will see a link to view and download it from the thank you page of the evaluation. Again, I'll also post the recording of the webinar and the resources mentioned in the presentation on the CADCA website in the next week or so. And finally, thank you so much for Dr. Noor for the wonderful comprehensive presentation and your very exciting findings. It looks like a lot of our members have gotten a lot of information from you that they feel that they can apply back to the community. So again, thank you so much. And thank you to all the webinar participants for your comments, questions, and attendance. So we'll see you all next time, and I'll make my way through the questions and the comments and get back to everyone. So thank you so much.